Hi, my name is Carol Jacobson, and I'm going to be the presenter for the two-day Everything Cardiac program sponsored by MedEd. I live in Seattle, and my whole background is cardiology. My favorite topic is hearts, and in this two-day program, we are going to cover several of the topics that I think will be helpful for you in your clinical practice. We will do a little bit of a physiology review. We're going to talk about cardiac drugs. We'll talk about physical assessment a little bit, heart sounds. We're going to talk about the most commonly encountered diagnostic groups like acute coronary syndrome, heart failure, and atrial fibrillation. I also do a quick review of cardiac arrhythmias and their treatment. And in this 2 days, we call it Everything Cardiac, but really all the topics are cardiac, but we couldn't possibly cover everything cardiac, or we'd be here for a week. So I think that we've picked topics that have been requested by nurses just like you who are working at the bedside, whether it's in a critical care unit or in a telemetry unit. I've had people contact me after this program thanking me and saying, I have already been able to apply some of the things that I learned in this program. So as you go through this program, I have a suggestion. Pick a couple of topics that you particularly feel like were helpful for you, and then go back to work and teach them to somebody else. It's the best way for you to learn something or to remember something is to teach it to somebody else. And so I always recommend that you pick a couple of things, go back and teach them, because that will not only help you to remember them yourself, but it will also help your coworkers to become maybe not quite as smart as you are.